Hey everybody, Dr. Gator here. We are going to demonstrate some dry needling techniques for low back pain with Jeff. Jeff, how you doing, buddy?
Doing fine.
Jeff came to us a few months ago, a lot of low back, leg stiffness, kind of just one of those situations where not very flexible and stiff a lot. Is that pretty accurate, Jeff?
That's correct.
So we decided to start kneeling him after a while, and he does better. Less pain. How do you think you're doing overall with the needling, Jeff?
I think it's doing a lot better.
Good. The interesting thing with a lot of people that have low back pain, they're active, they work out, they do all that, is they have a lot of tight hamstrings. And that's one thing with Jeff that we needle him is to loosen up his hamstrings a little bit, as well as some hip muscles, because we know that affects the low back as well. So here we go. You ready, bud?
I'm ready.
All right, let me grab this. So usually what we do starting out is we get a few needles in his hamstrings. Kind of get right into that area there. You okay?
Yes, sir.
Not too painful when I do that?
No, sir.
Good. There's different areas of the hamstring that we do. We do his medial part and his outside or lateral portion of the hamstring muscle. Sometimes it can twinge a little bit, but overall he does pretty well with needling. It's one of the things with when you have long-standing low back pain is you have to stretch or work on other areas too, not just the low back. And the hamstrings and the hips are a big part of why people have a lot of long-standing low back pain. So we want to work on those. The needling helps to kind of reduce the tension in the muscle, helps to increase the blood flow to the area that we're needling, which helps with healing, a little bit of pain management. And then of course people like Jeff have to make sure they're doing their stretches and taking care of what they need to do to help themselves out in the long run. So that's the hamstring. Get both sides there. Get on either side of his spine where these muscles are really tight right there. Get those needled. You okay?
Yes, sir.
Any pain when I do this?
No, sir.
No? Most people do well, like I said. Sometimes it stings a little bit, but overall, I think it's not that hard of a process to go through. And that's pretty much how we do his low back. And then we get right into his hip muscle. It's called your piriformis muscle. And that's a really tight muscle on a lot of people. And one more here. And sometimes we'll get up his mid back a little bit too, but he's actually doing better, feeling pretty good today, so we kind of do the basic needling on him. So what we'll do is we'll leave those in for a few minutes and then take him out and see how he's doing. Is that okay?
Sounds good.
Okay. Well, I hope that's helpful for everybody. And if you have any questions, contact the office and we will get some information out to you. Take care.